Okay, guys, great. So my MacBook is not connecting with my this thing, so I'll just directly tell from my slides. That should be okay. Okay, shall I go ahead?
Yes, sir.
Okay, is my screen being seen? Is my screen seen? Is my screen seen? I'm not getting any feedback. Let me just check.
Yes, sir.
Your voice is breaking. I'll just can you? Okay, fine. Can I go ahead? Is my voice clear? Am I audible? Okay, fine. So I think I'll go ahead. The if you have any issues, please do let me know. I think it's better to start right away. Can I go ahead? If I'm audible, I'll start off. I just need a chat box message so that I can go ahead. Yeah, fine, great. Okay. So the first thing I have chosen this topic for the PG residency is to give an idea about what exactly is GI sciences, that is gastrointestinal sciences, to have a brief idea about what the history was, how we have progressed so far, and where we might be going. And then why is it a fascinating branch for me, and how it can be a really good branch for the people who are aspiring to get into GI sciences. Now, if you get into the history perspective, I would say that one second. Okay. So, from history perspective, it dates back to even 200 to 500 years BC, where digestion was considered as a very important aspect of life from a very old literature. If you see the Greeks, according to their theories, food in the stomach was changed to chyme and then to other four basic systemic fluids, that is blood, mucus, bile, and the so-called black bile, which was actually the blood in the spleen. Now, that theory became a foundation for hypothesis based on the humoral pathology, which try to explain the essence of pathological changes in organisms. So later of late, from the time of Hippocrates, he named digestion as pepsis. Later on, Herophilus from Chalcedon distinguished a short part of small bowel following the stomach and named it duodenum because its length amounted to 12 Greek measures. Okay. So this is how slowly with time some important aspects of GI sciences got into the system. So I'll just briefly mention about the various small events that occurred over time. At around 310 to 250 BC, Erasistratos from Chios established a theory that blood is made from food after it is divided into useful and worthless substances. Okay. Then the food is mixed with blood, gets to the right chamber of the heart, and is used to nourish the lungs. Through the veins, the blood is transported further to nourish the rest of the organs. Now, the concept was very well accepted later by Galen himself. Now, Claudius Galen, who lived at the end of the ancient times, undertook great principle from Hippocrates and was also an important creator of important hypothesis which lasted for quite a long time. What he said is digestion starts in the stomach, where the food first is minced. Then it goes to bowel, where it is decomposed and then is transported to liver through the vessels. Okay, thanks to the sucking ability of the veins. And with the help of few system, the digestion occurs. In the liver, the food is changed into blood. So the blood processing or the synthesis actually occurs in the liver, which is pumped through the hepatic veins and is further through the cable veins into the heart. Now, Galen thought that the blood level is directly proportional to the amount of food intake. Now, this theory existed for quite a long time. So, what they thought was blood is formed from food in the liver. So, that was the principle which started off. Later, 2000 years after that, Paracelsus, first of all, he developed the thesis that disease is a natural phenomenon connected with human body. He claimed that it results from several conditions like low standard of living, inappropriate lifestyle. And what is peculiarly and particularly interesting is inadequate nutrition was also put forth. He later recommended a dietary treatment according to signature theory, with which he said that natural plant materials which resembled the particular failed organ is the treatment also. Like, for example, for jaundice or liver disease, he used to treat with yellow leaves of saffron. Okay, so that was his thoughts. Let me change it. Yeah, there must have been some disturbance. Let me just recheck it. Yeah. So these were different theories which came up over time, but I would say the breakthrough in medical world as well as the physiology and the pathology of the GI tract was with the appearance of Andreas Vesalius around 1500 AC. In his great work De Humani Corporis Fabrica, which was published in 7 volumes in 1543, he destroyed the previous Galenic anatomy and gave medicine the scientific foundation. Now, further, his disciples came up with various other principles where they came up with different things. Like in 1605, Bohin described the ileocecal valve and its function of preventing the colonic contents to get back into the small intestine. In 1642, John George Werson described the pancreatic duct in men. In 1654, Glisson carried out most of his investigations in the liver anatomy, and because of this fact, the liver fibrous sac has been named after Glisson. Okay, so there were so many good work after Andreas Vesalius and his theory of digestion happening in the stomach, and then he described it more based on autopsy-based findings. However, not all his findings were true, but of late he was the one closest to what the current physiology is. 23 years later, after maybe in somewhere in 1653 range, somewhere little after that, Bayer was able to identify duodenal glands, and later in the middle of the 18th century, Lieberkühn described the mucosal glands in small intestine, and so it was also named as the Bayer's patches. Now, So far, it was all anatomical approach and mechanistic approach. In due course, what really happened is the biochemistry approach started coming into play to explain few of the physiological aspects that were happening. Jan Baptiste von Helmont, who lived between 1579 to 1644, described carbon dioxide. According to him, the living processes are regulated by specific chemical substances, which he called the ferments, and he reduced all the physiological phenomenon occurring in the body to fermentation process. So he was more into about the fermentation process, explaining most of the things. And he was the first one to describe that the digestive ability of saliva, and this pointed out that the digestion process first starts in the mouth rather than stomach, which was thought of before. Okay. Now, according to Sylvius, the consequences of the disturbances in fermentation processes, like the imbalances between acidity and alkali, leads to various forms of diseases and upsets that occur. And with time, uh, adding on to the previous humoral theory, more secretions came into being, like saliva, pancreatic juice, lymph, and animal spirit, which is the fluid that is described as the one circulating in peripheral nerves. So there were a lot of changes with time. But in little later, in something like in 1700s to 1800s, Beaumont, who was initially a student, was working in an army hospital, actually found out one of his patients who was admitted with gunshot injury. He created a stomach fistula with permission of the patient and learned various experimental truths about the stomach secretions. It was him who first described about the hydrochloric acid from stomach and discovered its connection for digestion and various other aspects too. So if you see, it took us so much, around 50 to 100 years between each milestones that were occurring. It was in Claude Bernard who made impressive achievements, include chronologically the investigations of enzymatic function of liver and the pancreas. He discovered the digestive functions of pancreas and the reflux of bowel contents or to the pancreatic ducts, which causes severe changes in the gland and can lead to acute inflammation. So this was one of the first few description of pancreatitis, which can occur with reflux of bowel contents. He did that in his experiment where he injected bile mixed with oil in animals' pancreatic ducts. Followed by various other achievements. It was Carl Ludwig, this particular author, very detailedly describes about salivary gland and its innervation and the theory of saliva secretion. It was Ernst von Bruck who isolated pure pepsin. This was later by Rudolf Heidenhain, who, after examining the gastric secretions, he found and described three types of cells in the gastric mucosa. One is chief cells or zymogenic cells, which secretes pepsin, parietal cells which secrete hydrochloric acid, and also the epithelial cells. 1889, Wardley Jarosky called a new discovery of bacteria as Vibrio regula and found them to be also found in gastric contents. So this was later in a 1983, which almost after, say, almost around 100 years after that, Warren and Marshall were able to give us evidence of infection with H. pylori, which was importantly responsible for duodenal ulcers and various other issues. In 2005, both of them were awarded the Nobel Prize for their phenomenal work for coming up about this Helicobacter pylori, implications of which has been so much. Around 3 decades ago, there were so many peptic ulcer disease related complications and surgeries, but of late we hardly see these kind of issues. So thanks to the discovery of Helicobacter pylori and its respective treatment. GI physiology will never uh, be fulfilled if we do not talk about Ivan Pavlov. He was a great Russian scientist who described the physiology of gastrointestinal secretion and higher neural function. He was a good surgeon too, and his knowledge helped him prepare models. One of the famous one is called the small Pavlov stomach, where he used to create an esophageal fistula and was able to describe two important phases of feeding. That is the one initially stimulated by without just by giving food or tasting the food, which is called the cephalic phase, followed by the actual food phase when it reaches the stomach, which is called the chemical phase. Okay, so he has described most of this. He even describes enterokinase as an enzyme in the intestinal juice. Yeah, we all know how he described about the conditional and unconditional reflexes. Now, all of them do play a role even now for understanding so many physiological aspects. So at the beginning of 20th century, hormones came into being, and this new term, which was coined by English physiologists William Bayliss and Ernst Starling, introduced the concept of it's not just chemical and not just nervous regulation. There is some new system of compounds secreted, which are called as hormones, which can act by as causing different physiological functions at different target organs. So Starling named discovered agent, what he found was secretin and this kind of biocatalyst as hormones. John Etkin described about gastrin as a substance produced by antrum of the stomach, which stimulates gastric acid secretion. In the same way, in due course, we had somebody describe about cholecystokinin, and then we even have Latarjet, who we know quite well is responsible for describing vagal innervation and its role in acid secretion. Like this, if we go across, there were so many advances. Few of them have received Nobel Prize, some of them haven't, but they did play a major role in development of GI sciences. If we go from past, Ivan Pavlov, Robert Koch are few important people who we would know who have also received the Nobel Prize for the great work. Banting and McLeod received the Nobel Prize for discovery of insulin. There were many others, like in 1934, Whipple, Minot, and Murphy have received Nobel Prize for discovering liver therapy concerning anemia. It was Mr. Dale who got Nobel Prize in 36 for getting isolation of acetylcholine and its role in stimulus of nerves. In 1943, vitamin K was the discovery of that was given importance, and Nobel Prize was given. So a lot of Nobel Prize over time has been given for so many GI related discoveries which happened with time. In 1988, H2 blockers, H1 blockers were discovered, and its discoverers were given the Nobel Prize. In the same way, Boren and Marshall were given Nobel Prize for Helicobacter pylori discovery, and so on. So the recent one has been discovery of hepatitis C in 2020. Harvey Alter, Michael Houghton, and Charles Rice have received for discovery of hepatitis C virus. So the discoveries goes on, but these are few important things which I thought I should share. So far, we have seen various discoveries from perspective of physiology over decades and decades which have happened. Now let's see the evolution of the scopes. We see gastroenterologists as scopists, but believe it or not, it's important for us to be a GI physiologist, and in due course, we have this instrument with us, which we really are very proud of. And let's see about the evolution of endoscope. Now, first, it was Dr. Philip Bozzini from Germany who used a tin tube to look at the urinary bladder. And this was the first documented way of how a person could see inside the body using a light source. Then came a rigid scope, which was used. As shown in the picture, the patient really had to cooperate a lot, and rigid scopes were used. However, it was a very difficult task. Over time, it was 1931, Dr. Rudolf Schindler, who came up with the semi-flexible gastroscope. If you see the scope, this is a preliminary scope where the distal part could be moved up and down. He's considered the father of gastroscopy, and Schindler made incredible efforts to promote the use of gastroscopy as a diagnostic technique for gastrointestinal diseases. Now we have seen semi-rigid scope now came in 1957. Okay, 10 years after Indian independence, Dr. Basil Hirschkowitz developed the first fibroscope. You can see the entire scope was flexible, and towards the right picture, you see him using cameras to take photographs. In due course, these cameras got replaced by actually videos and pictures could be taken. So over the years, further improvements in the endoscopes themselves, smaller size, greater flexibility, ease of use, expanded endoscopy worldwide to budding endoscopists like me and many of you guys who may become gastroenterologists, making our life much easy. So we are really thankful for the generations of hard work which was done and transferred on to us. So of late, we have great ways of visualizing the entire mucosa of the stomach starting from mouth up to anus. We have various techniques to visualize them with advanced technology and even do therapeutics. We have reached that kind of development. I would be describing all these developments in our further classes, but just want to describe a few real important ones. Of late, we have upper GI scopies, enteroscopies to enter the small bowel, colonoscopies to see the colon. So the entire GI tract can be seen. The visualization has become so advanced that we can even have a procedure apart from high resolution. There is an entity called as endomicroscopy where we need not even take biopsy and we can even tell histopathological features by just the mere look of what we are seeing on the mucosa. That much is a development that has happened. Next, we'll see a side view scope. Side view scope is what we use for doing a procedure called ERCP. It usually used to get inside the papilla and try to remove the biliary stones and the pancreatic duct stones. And various other indications are there. It was 1972, Dr. Peter Cotton who did this procedure first time and was described in the study in the gut. Then, with respect to therapeutics, various advances are there over time. Let it start from a simple biopsy forceps to polyp snare to APC, that is argon plasma coagulation or dilatation procedure. We have so many accessories to our armamentarium to do different procedures. The development is so advanced that of late we do procedures which are also mimicking surgical procedures. One of the most important of late procedure is third space endoscopy. Now, third space endoscopy is where we create a tunnel between the walls of the organ involved and try to do procedures. So that much has been the development. So what I would want to say is there are different components of GI system. It could be luminal, it could be liver, it could be pancreatic and biliary system, including various interventions which could be diagnostic and therapeutic. So what I would want to tell you is it's not just GI sciences is gastroenterology dealing with stomach and basic endoscopies. We deal with so many organs to not ever get bored, and there are developments happening in each of them in a great depth. So I have made this talk really small just to make you guys understand that GI science is fascinating because it is combination of so many things. Let's start off. We first have to have a strong internal medicine to approach various symptomatologies and signs. Like say recently I had a case, an elderly lady who presented to me with history of persistent vomiting since 2 to 3 months. She was occasionally dehydrated, intermittently also getting some of the other infection with outside food and was admitted to us. She was hypertensive, no other comorbidities, was asthmatic, was on intermittent inhalers. That is the history which was given. We did almost all the investigations, general investigations. We could not pick up what's happening with her, but we were sure that it was organic. So even basal TSH, cortisol, CBC, everything looked normal. Sometime when she gets admitted in emergency, there was stress hyperglycemia going on. So what we did was we did a basal cortisol level. Basal cortisol level was borderline low, wasn't too low to explain an secondary adrenal insufficiency or iatrogenic adrenal insufficiency. But then when we did an ACTH test, we realized that the rise was not adequate. And when appropriately the patient was started on low dose steroids, she did really well within the fourth day of discharge. So there are various great stories like this where we have picked up cases because we did have a good internal medicine knowledge. We have cases where patient has presented with acute pancreatitis, hypercalcemia induced, and we have gone ahead thinking about hyperparathyroidism, and we have once we have removed the parathyroid gland or the hyperplastic gland, the patient was absolutely doing well. So you do need a lot of general medicine principle to approach so many common signs and symptoms that the patient presents with, like dysphagia, icterus or jaundice, abdomen distension, constipation, diarrhea. So your mind is always occupied on approaching these kind of cases. Okay. Then, of course, the branch has feather on the cap is also procedures, a wide variety of procedures like upper GI-scopies, colonoscopies, endoscopic ultrasound, ERCPs, enteroscopies, and so on. We need to also think like a radiology because we deal with a lot of CT, MRI abdomen, and we also do ultrasound like in the form of endoscopic ultrasound and also ultrasound percutaneous, and we can do some therapeutic procedures too. In fact, there are some interventional hepatologists who even do HVPG and tips equivalent to what an interventional radiologist do. So it just depends upon what their interests are and where you're training yourself. Minimal access surgical procedures are done by us. We do stitching inside the mucosa, though not confined to just outside, but predominantly an endoscopic procedure like POEM ESD has really widened our approach from a medical gastroenterology perspective. For some of those who love medicine and want to deal with ABGs and immunosuppressions, transplant hepatology gives us a good idea about use of a lot of these medications like say for induction, we will be using quite a good dose of steroids post-operation. The patient is going to be on some tacrolimus and we have to adjust it on day by day. We'll be also seeing a lot of opportunistic infections and we manage them. Inflammatory bowel disease, again, we use a lot of biologicals, and autoimmune hepatitis where we again have to taper with a lot of immunosuppression. So there is good amount of work for the brains. And for those who really love physiology, there are manometry, 24-hour pH impedance studies, and biofeedback therapies to, which are very kindling to our mind and brain to look at these things. For those who love critical care management, there are enough decompensated chronic liver diseases and acute severe pancreatitis, patients with sepsis, patients with so many complaints who we can manage even from a critical mind in an intensive care setup. Also, we need to be good psychologists because we have good amount of patients who come to us with a significant functional aspect, and there are recent lot of studies on disorders of gut brain interaction, and our skills of psychology do help us a lot in handling these patients who are almost 50% of our OP visits. Okay, so and again, our emergencies are not completely nil. We do get emergencies and it's quite rare, but these are GI bleeds and cholangitis and these. So somebody who really wants to handle emergencies also, his pocket is full. And for some of us who love teaching and research, we have enough opportunities in the branch. So in nutshell, I would say medical gastroenterology is a branch where a person will never get bored. He has enough things to handle and he has enough things to concentrate on and become an expert at some other thing which the branch can offer. So this talk has been primarily meant for PG residents who want to have an idea about what medical gastroenterology deals with. That's the reason the topic was as simple as that, to just make you understand as a physician, as a gastrophysician, what all are the things that we generally do. Thank you for giving this great opportunity. And in due course, we will be going across approaches of so many new symptoms, signs, how to present a case, what are the different viva voce questions that is expected, and from practical, pragmatic perspective for clinical practice, may it be in OPD, may it be in intensive care center, may it be procedure related, may it be viva voce for entrance exam. We in nutshell have a lot of classes which are going to be uploaded in the PG residency program. So stay tuned and log in yourself to get into the program and see how amazing it's going to be. And a lot of subject experts will be giving you so much knowledge from their experiences. Thank you.